There's so many reasons why I entered dentistry, and I think the number one thing that brought me to endodontics was the ability to take patients out of pain. And for them to come to me feeling stressed, uncomfortable, uncertain about what was going on, and for me to be able to relieve that discomfort for them was super rewarding. I also, in my private life, am an artist, and I find endodontics to be the perfect blend of science and art. I've always enjoyed working with my hands. I'm a potter, and I can use my scientific skills for accurate diagnosis, treatment planning, and my artistic skills for beautiful microsurgeries, and it satisfies both parts of me. We're so lucky to be practicing endodontics in this era. We have so many choices for patients, and we can really provide them a wide array of options. There's nothing quite like saving your natural tooth. And honestly, most patients choose to save their natural tooth if it's possible. However, we don't have to practice heroics. In certain cases, implant is the best option. And it's amazing to be able to provide patients with solid alternatives to saving their natural tooth. However, with advancements in technology, ability to have advanced irrigation protocols, have CBCT imaging, we can really see what's going on, see if there's a way we can treat the tooth, save the tooth, maintain the natural dentition, maintain the patient's oral health at the highest level. I've had so many great mentors, and I feel fortunate to have been able to train with the best. Here in Boston, we're lucky to have 3 different endodontic residency programs. Personally, I was a student at Harvard for both my predoctoral education and my postdoctoral education, and I trained under Bob White, and I still teach there and am faculty under the direction of Jennifer Gibbs, and they're just amazing clinician scientists that we're able to collaborate with. Endodontics is a special field that allows us to be compassionate providers, care about the whole person. We're able to listen to patients, hear what's going on with them, understand, and properly diagnose and treat them as a whole person. And I think that's really attractive to female providers, to females, to be able to provide that level of compassionate care. And dentistry also allows a lot of flexibility. So we both can be clinician scientists, and we can have a meaningful home life, a meaningful life outside of work as well. Right. A lot of people find endodontics intimidating as a field, as a specialty in dentistry, because you have to work so carefully and so blindly. You have to really be able to feel what you're doing in your hands, in your fingertips, and as a former or current artist, it really blends that so beautifully for me, in that the science and the art and feeling the canals, using the instruments, really being able to visualize in my head what I'm doing, because so often you're working blind. It's a beautiful field. I feel so lucky to be able to practice in this group of clinicians, being able to go over cases, review cases together, and really come together as a group of high-level specialists to decide the best treatment for our patients. It feels good to be able to provide such good care. And it's rare in healthcare today to have such a collaborative environment where we can take the time to sit down and discuss cases, and we can look at x-rays together, and we can point things out to each other that maybe one of us didn't see, or treatment goals might be different for different specialties, but when we all discuss together collaboratively, we can really come up with the best care, the best treatment plan for the patient. Well, I'm only one person, and I'm not available 365 days a year. So we do collaborate with other endodontists outside of our practice, but I am here to treatment plan, to go over cases, and on a non-emergency basis, we try to be able to treat everyone in-house.